So we'll be continuing on with the duties of a medical biller in honor of Medical Billers Day, which is Thursday, March 26, 2026. Now, it is not the same date each year, but it is the fourth Thursday of March, so the date changes a little bit. But we're going through what medical billers do, how they fit in the revenue cycle, and this is part 3 of that series. If you haven't caught part 1 or part 2, make sure you check that out. I will link that above. And I'm going to put on the screen my interpretation of the revenue cycle and where we are at today in this video as far as reimbursement management, which is what we'll be talking about. If you don't know what the revenue cycle is, I will also link that video that I did about the revenue cycle, because medical billing fits within the revenue cycle. It is not the complete revenue cycle, but it does fit in within the revenue cycle. And without AR management, money slips through the cracks. Medical billers are there so that time does not cost the practice money, and I'll explain that throughout the video. Now, what is AR management? AR management is where I would say the bulk of what a medical biller does. This is where that happens. This is where you really can shine as a medical biller. And AR management is basically just trying to collect money for your practice that has not been received. And specifically, we're going to be talking about money that hasn't been received from the insurance companies, from third-party payers, but that money in general could be from whoever, a patient or whoever. Now, this is where you'll be dealing with things such as the agent reports, denials, appeals, medical record requests, provider or coder queries, insurance follow-up and calling. In the AR management section, this is basically where you'll be focusing mainly on that. Now, of course, in the other sections, you might do a little bit of this as well, but this is where I would say that you would really hone down and focus in these particular areas. Now, how is AR management done? So before I jump into that, let me just break it down simply to say anything that is above 1 day is something that is aging. And so as an example, I always say when you're born, let's say today, March 10th, 2026, and tomorrow, March 11th, 2026, you would have aged a day. So you can age, 1 day, or you can age 30, 100, how much ever days. So when you're working with your AR or your aging AR, that is receivables that have aged past 0 days, you want to first work on reports of what is outstanding. You want to know what you need to collect, from who you need to collect it from, as far as which insurance company, which third-party payer. You want to print an agent report. Now, an agent report usually shows the different buckets or the different days that the claim has been an agent. Now, as long as you have a claim that you have sent out and you haven't received payment on it or full payment on it, that claim is still agent. You usually have 30, 60, 90 days, and 120 days plus. You don't want to have claims sitting for 120 days plus, but truthfully, it happens. You also don't want them to even reach sometimes to 90 days, because a lot of insurance companies or third-party payers have something called timely filing. And so if you have not sent out a claim, or if you've sent it out and they haven't received it, then they are not going to pay for it. Now, there are some ways to get claims paid if you pass timely filing, but I think that puts on a lot more work and a lot more effort than you need to. So instead of having to do all of that, you should try to probably get your claim sent out and get it processed within that timely filing time, or that timely filing period. I usually do an agent report for my providers monthly, but that all depends on the practice. That all depends on the staff, how much people you have doing it, how much patients you see, how much claims you sent out. Sometimes you may need to do the agent reports more often. I have seen practices do it weekly, especially if they're seeing hundreds and hundreds of patients. They don't want to wait till the end of the month to follow up on claims. But if you have a smaller practice, you will probably be able to wait a month's time and do that follow-up or that agent report, work that agent report is what we say. You would probably do that monthly. Again, this is dependent upon your practice, but a usual and normal practice is to pull your agent reports monthly and work them. After you have pulled the reports, you want to decide what you need to work on first, what you need to work on next, how soon you need to work on these things. Now, how I usually like to do it is I will pull a report, and let's say I will pull a report that is 30 days plus. For me, it doesn't make sense to work on an agent report from 0 days up, because if you're just sending out a claim and now you're calling the insurance company 2 days later, that's a waste of time to me. You as a medical biller should know how soon or how quickly a payer pays. Some people like to make it seem that payers will pay your claim, in 2 days and 3 days, and they start to question, oh, well, what happened, and da 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 da. Okay, that is all good and dandy, but I know as a biller working in the field for many, many years that, let's say for me in the area that I work in, because you also want to keep that in mind, Cigna will make a payment on a claim, let's say 2 to 3 weeks. As long as there's no errors, there's no issues, they usually pay that quick. And it also depends on how you are receiving your remittance advice and how you are receiving your payments, the actual money. If you are receiving these things electronically, which is what they usually recommend, then you will receive it quicker. If you are receiving it by paper, then that will be longer. So you have to keep this in mind when you're trying to decide whether or not you want to call and follow up and do all of these things on a claim. So after I've decided what it is that I want to do, who I want to work on, I may want to work on United Healthcare claims first, because I know that my timely filing for this payer is 60 days. And then my timely filing for Cigna, maybe 90 days. And my timely filing for Medicare is 365 days. So Medicare maybe last in me working my agent report. I don't usually work my agent report by how it is printed. I usually print my agent report is usually printed by payer. So it would go by payer, and it would go by alphabetically. And so it will start probably off with Aetna, and then APW, and then, Blue Cross Blue Shield, da 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 da. I don't work my agent report like that. Like I stated, I usually work it depending upon the timely filing limits of each of my insurance payers. Sometimes if I know that it is hard to get in contact with a payer and I may have to call them 3, 4, 5 times, I may work them first. I also work my agent reports by my energy, by how upbeat, how I'm feeling, how much mental space that I have. Because again, like I just said, some payers are hard to get in contact with. Some payers, when you go on their sites, it's hard to pull up any information. You have to, go through all of this rigmarole to get it, or you might have to call. I'm just keeping it totally real with you. It's not going to always be easy. So you have to kind of figure out how you want to attack this agent report. Let me put it that way. You want to be able to figure out how you want to do that. And I don't want to work on my agent reports for days and days and days. And so I'm working on it for 2 weeks, and then by the time you know it, it's the next following month. I want to work my agent reports, for me at least in the practice that I work for. It's not too huge and it's not too small either, but it's kind of like in between. So I would work that agent report maybe 3 days the most. I don't want to work, and not the full day. I would take maybe an hour or 2 hours to work that agent report, do what I have to do, and then move on. I don't want to be working on that for so long. So after I determine which payer I'm going to work on, then I want to know what is the reason that the claim is on the agent report. Now, there are many reasons why you would have claims on your agent report. It may be that you never sent out the claim. It may be that it was rejected, that it was denied, that you are working on that denial, and this was something that you was working on for last month. There are several reasons why you may need to work this particular claim. And you might say, well, why is a claim on there that I've never sent out? I don't know. Sometimes a provider may put in a date of service maybe after the fact. Just maybe many reasons why that may happen. But the agent report will catch that. And I usually filter my agent reports by the date of service. So if a provider does put in a claim or a date of service that I didn't send out, I usually catch it because I usually pull the report by date of service. I know there are different filters that you can use, and you need to keep that in mind when you are printing your reports, you need to remember the filters that you're using so that you can continue to keep those same filters every time you print that report so that it can stay consistent. But I usually use date of service, and so sometimes I catch claims that I just never sent out, which is good because I don't want to, again, pass the timely filing. Then you might have claims that were rejected, and this might be claims that you didn't catch that were rejected that were on your clearinghouse report, or this may be claims that were rejected from the actual payer. And so maybe it's not on your clearinghouse report, which it should be, but maybe it's not there. And a rejection is basically when it is not entered into the payer's system normally. It was not processed, it was not adjudicated, it didn't even probably get a claim number. Like, that's the difference between a rejection and a denial, and I should probably link a video about that as well, because sometimes the terms are interchangeable and people say rejections when they mean denials and vice versa. But there is a specific difference between a rejection and a denial. Now, with a denial, you have a claim that was processed by the insurance company, and for some reason they denied the claim. They don't have to deny the whole claim. They can deny a portion of the claim. They can do whatever they want because they're the ones who's processing it. Not to say that it's correct, but they do what they want. And then you have to find out if this denial is correct, if it is in fact supposed to be a denial, if it is still the insurance payer's responsibility, or if it's the patient's responsibility. You have to figure out all of these things. And you also may have on this report denials that you were working on. Sometimes you can't fix a denial within 1 month. Sometimes it takes a few months to get through that denial, to do what you have to do in fixing it. And so you might have seen this particular claim on 2 reports before this report, and so you already know what's going on. Maybe you've been working on it throughout the month, and so this may also be on your agent report. But this is where you catch all of these things, and where you can also, call the insurance companies when you need them, and you need to find out more information, or you need to dig deeper, send out appeals, ask your providers questions. Because if you get a denial and it's a coding error, or it's something that the provider needs to deal with, this is the time when you will actually make that query, try and figure out what's going on. If you need to send medical records, if you need to request these records from your provider, this is the time to do all of that. And I say that it's during this time. It's not only this time that you do it. Let me say that. I've been putting these in sections, but sometimes things get totally thrown off and they're done on different times. But I like to just take a couple of days, a block of time, to just do these things and focus on these things. When you're doing denials throughout the month and all over the place, it can sometimes be inefficient. You can use up a lot more time. But when you're in a zone, at least for me, when I'm in a zone and I'm working my agent report and I'm working on denials and issues and queries and all of this stuff, then I can be more efficient with my time. I can send the provider all the queries that I need to send them at one time. I can work on all the Cigna patients that I need to call the insurance company one time. And this saves me time instead of doing one here and there each and every day. Now, if you're a medical biller interested in starting your own medical billing business, or maybe just adding a few extra providers on your roster, doing a 1099 contract with them, then make sure you schedule your remote one-on-one with me. If you have any questions about how you should be going about doing this, what you need, how to price, all of those things, I do one-on-one remote consultations. The link is always in the description box. Now, why does AR management matter financially and operationally? So it matters because you don't want money to slip through the cracks. As a medical biller, this is what we do. We want to collect reimbursement. We want to get the providers paid when they're supposed to. We want to make sure that there is continuous cash flow for the provider, especially if they're seeing patients continuously. We can't make miracles. We don't bring money out of thin air. The provider does have to see the patient and perform specific services on them in order to receive payment. But we are there to make sure that they're getting paid at the rate that they're supposed to if they're taking insurances, and that they're getting paid on time. And with AR management, we need to make sure that we have specific workflows that keep us consistent and timely. With timely filing, There are some times when you can override the timely filing limits, but that is going to be inefficient to you. That is going to make you have to do work more than you may want to have to do work. You can work that, sometimes you may have to do that with specific claims that you have, but you don't want it to be each and every claim that you have. You want to make it as easy or as light as you can. So you need to have a workflow. You need to be able to work through that workflow consistently and timely, and it will keep you up on keeping the revenue consistent and keeping your practice flowing when it comes to the income. Within this AR management, you also will have the opportunity to do internal audits. If you're noticing that while you're doing a specific payer, that there is a continuous denial for maybe a specific CPT code, or maybe two codes that are put together, and you're noticing that you did this thing on 3 patients and each patient it was denied. This is where you will probably catch that information, because now it's all in one particular section. You're noticing that you went through 3 claims where the patient had this particular service done and all of them was denied. It will help you to either figure out why it's being denied and having a solution to not get it denied, or you may decide that we won't do this again on the same day because it's actually not covered, and you want to make sure that what you're doing is covered. You want to make sure that the provider is not wasting their time. So this is where you can do these internal audits and be able to relay this information to the coder, to the provider, to the front desk staff, so that you won't be making these errors continuously over and over again and having a whole lot of claims that are not paid. If you haven't checked out the claims and reimbursement management videos, then make sure you do, and I'll see you again in my next video.